Hi, this is Steve Rowe, Executive Director at Oaknoll. Today is Wednesday, August 18th, and I get to record the weekly message for the second week in a row today. Unfortunately, our administrator, Kim Bergen-Jackson, is out sick today, so I am covering and we'll share some information with you. There's three main things that I'm going to talk about today. The first, and I think I mentioned this last week, that the state surveyors had been in our health center in early August. They left last Tuesday, and earlier today we received the report that we need to respond to. We received three very minor deficiencies. They are D-level deficiencies, which isn't going to mean anything to most of you, but the definition of a D-level deficiency is that it says isolated deficiencies that constitute no actual harm with potential for more than minimal harm that is not immediate jeopardy whereby corrections were required. So what that means is that this is basically a very minor deficiency. We need to correct it and we need to respond, but it's not something that they had huge concerns about. And it turns out that all three of these deficiencies are really paperwork related for what we've got documented in resident care plans, the way that we investigated, as an example, a fall and documented the ultimate cause of that fall, different things like that. So that's actually a good thing for us in that it's like as they were here, there were actually no concerns about the care that was actually being provided to our residents. The medication error rate that they observed when they followed our nurses through a medication pass was 0. So residents were getting the right medications at the right times. They had no concerns with personal cares that were being provided. They had no concerns with dining services or with the environment. So all of that is very, very positive for us. And paperwork concerns are actually the simplest things for us to deal with. We have 10 days to respond, and we will write up a plan of correction, and that pretty much will be it for this survey process. Our goal is always to have 0 deficiencies. I've been at Oaknoll for a little over 22 years, and there have been 2 times in 22 years that we've had absolutely 0 deficiencies. One of those 2 times was the last survey that occurred in October of 2019. So as I said, our goal is always to have 0 deficiencies, but if we have to have any, this is the type to have, and we'll do what we need to move forward. So thank you to Kim and to our nursing leadership team for all of their work over the pandemic, keeping people safe and providing excellent care. And it's like if the surveyors need to find something, it's great that what they found was in care plans rather than in the care actually being provided. Second thing I want to talk about today is some changes that we are making at Scotty's Restaurant at East. There was a communication that went out today in all resident mailboxes that outlines what those changes are, and it's just simply in response to continuing challenges with staffing, and especially now as we hit next week and many of our student employees return to school and adjust hours. We're doing the best we can to keep things operating as normally as possible, but we also need to acknowledge that there are some nights where we just don't have the right staff to do our normal service. So probably the biggest single change that you'll notice is that on Thursday evenings at Scotty's Restaurant, it will be carry out or delivery only. We will be able to continue to provide food service out of Scotty's Restaurant five days a week as we are currently, but that written communication that is in your mailboxes kind of outlines any of the changes that we are making there. We're also working hard trying to recruit and train employees as cooks and as servers and within our health center as certified nursing assistants so that we are able to continue to or able to get back to the normal level of service that we want to be at. So thank you for your patience with that as we're working through these things. We will try to keep you informed as we need to make changes. We want to give you some notice about it and not just spring it on you the next day. But it's like this is our reality right now, and we're trying to do the best we can to maintain service levels and food qualities to your standards. The last thing I want to talk about is booster shots. We've received a lot of questions over the last week or so about booster shots, and it seems like the information is changing minute by minute. As I was preparing for this video recording earlier this morning, I pulled the CDC guidelines on boosters. I just did a Google search for that, and what I found was a document that was updated as of today, August 18th. It says CDC now recommends that people whose immune systems are compromised moderately to severely should receive an additional dose of COVID-19 vaccine after the initial 2 doses. One thing that was clear in the CDC recommendation that was just published earlier today is they were not talking about this as a booster shot, but they said that people who are severely immunocompromised should receive the additional dose, and that includes people who have been receiving active cancer treatment for tumors or cancers of the blood, who have received an organ transplant and are taking medication to suppress the immune system, people who received a stem cell transplant within the last 2 years, people who have moderate or severe primary immunodeficiency, advanced or untreated HIV infection, and active treatment with high-dose corticosteroids or other drugs that may suppress your immune system. It's important to note in the list of items that they said would make you eligible for that 3rd dose of vaccine, that age was not one of those criteria. I know that we have had some residents who have gone to their local pharmacy, and some have walked out of there having received a 3rd dose of vaccine. Others have walked out of there having not met the requirements and did not receive the 3rd dose of vaccine. So at this point, that is our reality. As I was preparing for this, Greg Jones came into my office and we were talking, and he said, "Hey, did you just see this?" He pulled up his phone, and it's like apparently President Biden in the last 15 minutes to half an hour had made an announcement that the booster shot will be available to all of the vaccinated people later this year. So I dug a little bit further and found an article that must have just come out, and what that says is that anybody who has received the vaccine earlier this year is going to be eligible for a booster shot effective the week of September 20th. And the criteria for getting that booster shot it says people 65 and older and individuals in chronic care facilities are expected to get boosters initially. So that makes me think that like the process that we used with Walgreens to host vaccine clinics back in January, we will more than likely be coordinating with Walgreens again to do that sometime in late September. So what you need to know right now is if you want a 3rd dose of vaccine, Oak Knoll cannot administer that to you. We don't have it, and the only way that you would be able to get that is to go to your local pharmacy, and if you meet the criteria, they will give it to you. Beyond that, It sounds like, with the most recent information, later this fall, we most likely will be getting additional doses. And if that turns out to be the case, we will be providing a booster shot clinic at Oaknall when we can do that. There will clearly be more to come as we learn more and as the situation develops, but that's what we know as of this moment in time at about 10:45 on Wednesday, August 18th. I hope that was helpful to you. We'll talk with you again next week. Take care.